Anything else? Any other criteria? You are right. So actually confounding will be that there are other variables which are creating confusion in your search for the truth. So there are other confounders which are associated with the exposure outcome, and now you are confused. The estimates which you are making, are they because of your exposure or are they because of these associated factors? Now then there are some other things which you need to consider when you are looking at your estimates. Now, these are not really challenges or problems, but these could be parts of your research question. That is the effect which you are studying between the exposure and the outcome could vary by a third variable. That is, there is what is known as an effect modifier. So there is a variable which modifies the effect of the exposure on the outcome. And you may be interested in reporting the effect across these modifiers, or especially when you're looking at medications, you may be interested in studying whether the joint effect of the medication is better than the independent effect of each of the medicines which are being given to a patient. So that will be interaction. So these are very concepts which are very close to each other, but differ in terms of the kinds of reporting and interpretation done. Another thing which could be mediation or mediators. So you have exposure A and B, and you are interested to know how much of this association or effect of A on B is a direct effect and how much of it is through a mediator, which is known as an indirect effect. So these are some concepts which will help you clarify or work upon your research question and then perform analysis accordingly. So to just understand or concretize on these concepts, what is confounding? Confounding is an alternative explanation for the association which you are studying. So you are studying an association between A and B, but you feel that there is an alternative explanation for this association, which is creating a confusion in your interpretation of the association. Then you say there is confounding. What is effect modification? Okay, you are studying the association between A and B, but this association varies or differs according to a third variable, which we call as the effect modifier. So it could be say X and Y are the two subgroups of the effect modifier, and this association differs according to a third variable that is known as an effect modifier. Interaction is where you are interested in the joint effects of the exposures, and you want to see whether the joint effects are significantly different from the independent effects of the exposures. And mediation is where you are interested in evaluating and differentiating or dissecting the direct and the indirect effect of the exposure on the outcome. Are you with me? One of you all can respond and I'll know that you are with me.
Yes, ma'am.
Yeah, thank you, Joyce. So these are the basic concepts about confounding, and thank you, Shweta, and about the other terminologies which we saw. Now, moving forward, we'll just discuss a couple of examples and then move ahead. So again, trying to get to the truth. Supposing you want to study the association between diabetes mellitus and COVID-19, right? So this is the diabetes is the exposure and COVID-19 complications are the outcome. And in your study, you estimate a risk ratio of 2. So how would you interpret this risk ratio? Anyone can help me with the interpretation? Dr. Sampath?
Yes, ma'am. Ma'am, risk ratio can be described in like those having diabetes having 80% chances of those
So they
patients
have
having
two
diabetes.
times. Those
Two
with
times
diabetes have 2 times higher risk of COVID-19 complications compared to those
complications.
without diabetes. That is what you will interpret, right, Sampath?
Yes, ma'am.
Yeah. So when you get a value, you should ask yourself how confident you are. Of course, precision, because I have not mentioned any 95% confidence interval, but how confident you are that your findings are valid. And then, of course, precise, depending upon the 95% confidence you get. Now, if this would have, the risk ratio would not have been significant, that is your 95% confidence would have crossed the value, the null value of 1. One question you should ask yourself is, do you have sufficient sample size, which will give you the power to detect a association or a difference which is truly there in the population? That is, I'm talking about random error. Another question you should ask yourself is, are there any biases in your study design, any selection bias or any measurement bias? For example, if you have done a hospital-based study and during the pandemic, there is a criteria for admission that patients with diabetes who present to the hospital should be thoroughly investigated, admitted, then detection of complications would be more. So something like that, then there would be selection bias and that would overestimate the risk ratio. Another question is, are there confounders? For example, it could be, say, obesity. So is this association which you are seeing between diabetes, COVID-19 complications truly because of diabetes, or is it obesity which is associated with, which is more likely to be there in diabetic patients and may be an independent risk factor for COVID-19 complications? So what you are talking about as the association between diabetes, COVID-19 is partly or wholly because of obesity and not diabetes. So you have to look for these alternative explanations to rule out confounding. So these are potential confounders which are enlisted here. Then you have to ask yourself, are you interested in factors which could modify this effect of diabetes on COVID-19? For example, on one hand, we could feel that obesity is a confounder, but you could think of obesity as an effect modifier. What does this mean? That is, you want to see whether the effect of diabetes is different in obese individuals compared to non-obese individuals. So you are still looking at the effect of diabetes and COVID-19, but you feel this effect will differ across two subgroups, obese and non-obese individuals. Here, we would say that obesity is an effect modifier. Or you could have a research question where you feel that the risk of COVID-19 complications is more or is different in patients who have diabetes and hypertension compared to patients who have only diabetes or only hypertension. So this is interaction, that there is an interaction because the joint effect is it different from the individual effects of diabetes, hypertension. And then you could be interested to study if there is an association between diabetes and COVID-19, how much of this is a direct effect, or are there mediators like, say, coagulopathy? So your diabetes and your COVID-19 complications could happen through a mediator, which is coagulopathy, and some of it could be a direct effect and some could be through a mediator. Now, these concepts we'll look at in detail in the next session. That is, concepts about effect modification, interaction, and mediation. But you should, at least in this session, understand that these are different concepts and how they are different from each other. Now, we will look at another example, and I want your inputs now. Supposing we are looking at the association of alcohol and lung cancer. Your exposure is alcohol and your outcome is lung cancer. Now, another variable which is disturbing you is smoking. Now, can you just think about confounder? Now, supposing I think that smoking is a confounder, how would you think about smoking as a confounder? You are studying alcohol and how it is related to lung cancer.
Ma'am, I guess to hello.
Yes, Dr. Anudeep.
Ma'am, I guess to address this issue, we need to go more deeper about specific about smoking habits, and we like to adjust for it using using tests like multivariable regression or stratification.
Correct. So smoking is a variable which you think could confound your association between alcohol and lung cancer. If you find an association between alcohol or alcohol consumption and lung cancer, somebody would ask you, is it really because of alcohol, or is it because alcoholics are more likely to be smokers and it is smoking which is causing the lung cancer and not your alcohol, right? So you will have to consider smoking as a potential confounder. Now, how would you consider smoking as an effect modifier? Now, supposing you think that smoking, you also want to look at smoking as a effect modifier. What does that mean? Anyone can try. What is the effect we are studying? The effect we are studying is the effect of alcohol on lung cancer, right? Agree with me? So if
Yes,
you
ma'am.
do
Yes,
a
ma'am.
case control study, you will get some odds ratio, right? Now, when I say smoking is a effect modifier, what I will test in my study is whether this association, that is this odds ratio, differs according to two groups, smokers and non-smokers. So I will have odds ratio 1, odds ratio 2. So there will be two categories, two strata as Anudeep mentioned. And between smokers and non-smokers, I will check whether the odds ratio differs. If it differs, I will say that smoking is an effect modifier for the association between alcohol and lung cancer. Do you get me?
Yes, yes, ma'am.
Yeah.
Ma'am, do
Now,
we have to check the
sorry,
influence of smoking or alcohol for saying it
sorry.
is an effect modifier? Do
Yeah.
we have to always check that the association between smoking and alcohol? Like if it is not affecting alcohol, then we can remove it, confound, and then focus towards effect modifier.
Yeah.
Is there something
So,
like?
yeah, in the next session, I will tell you all the steps. Actually, when you want to look at such associations, the first thing to do is to rule out or to check for effect modification. And if effect modification is ruled out, then you think of confounder. Okay. So first you check for effect modification, because if there is effect modification, it is better to report effect modification, because through effect modification, you are actually identifying high risk groups. So if I find that the odds ratio in smokers is more and there is no association in the non-smokers between alcohol, lung cancer, might be I will focus on the smokers who I consider as risk factors. So there are programmatic and policy implications for effect modification, which needs to be reported. You do not adjust effect modification, you report effect modification. Once you rule out effect modification, then the next step is to check for confounding. Do you get me, Anjana?
Yes, ma'am.
So this you will get more clarification in the next session where we focus on effect modification. Then the next concept which we were looking at was interaction. So in interaction, anyone would like to attempt in this example, how or what is your interest when you are checking interaction?
Alcohol and smoking together has an increased risk of causing lung cancer rather than
Yes,
alcohol alone.
yes, good, Anjana. So you would like to calculate odds ratio separately for smoking, separately for alcohol, and then the joint effect. The key word here is the joint effect of alcohol and smoking, and see whether this joint effect is significantly more or different from the independent effects of alcohol and lung cancer. If it is so, you will say there is an interaction. And for this example, of course, we won't look at mediation, but I have told you mediator would be alcohol and lung cancer direct effect. Is there any indirect, a variable through which this effect of alcohol on lung cancer can occur? So I think this was one part where the introductory part where we are just looking at these concepts and how they are different from each other.